Hi, my name is Labib Riachi, and I'm a consultant surgeon in obstetrics and gynecology, specialized in gynecology and advanced gynecological surgeries and robotic surgery. I'm at Medi Clinics Hospital in Dubai, and I would like to discuss with you today the diagnosis of cervical cancer, the prevention and awareness, because of January is Cervical Cancer Awareness Month. Cervical cancer affects women and affects women at all ages, specifically between the ages of sexual activity, and the peak of it is at the age of 50 when it's mostly diagnosed. Sexual health is very important in prevention of cervical cancer. Cervical cancer worldwide affects around 600,000 women plus, and we have 342,000 plus women died of cervical cancer in 2020. I want to talk about the United States, where we have cervical cancer, and when we used to be there, the diagnosis of cervical cancer is made by pap smears and conventional screening methods with also HPV testing. Around 14,500 cases were diagnosed in 2020, and almost 4,000 plus cases died in the US. If you compare that number to the number of cases where I just mentioned 600,000 in the rest of the world, it will tell you that in developing world countries, it happens at a more important rate, and the death rate is higher. And this is because of no prevention and no awareness and no campaigns in doing pap smears and HPV testing. Cervical cancer diagnosis is usually late if it happens by the patient herself. She would have irregular bleeding or heavy bleeding or postcoital after intercourse bleeding. However, if screened properly, when a woman comes or a young girl comes sexually active to her doctor and does proper screening with pap smears, when someone puts a speculum in the vaginal area and collects a sample from the cervix and send it to the lab and check for the cells if they are abnormal or not. And in addition to that, we have new testing for the last 10 plus years that we do is HPV testing. HPV stands from human papilloma virus. HPV, human papilloma virus, is sexually transmissible, and cervical cancer in 99.7% of the time is caused by human papilloma virus. So HPV is transmitted sexually. It's preventable, hence, by decreasing the risk of unprotected sexual intercourse, or having intercourse with multiple sexual partner, or having intercourse with a partner who was exposed to HPV, or sometimes having other sexually transmissible diseases with HPV can compound the effect and advance the stages of getting from a simple infection to cervical cancer. I want to emphasize is that human papilloma virus is very common. Almost 50 to 70% of people who engage in sexual activity, by the time they're 50 years of age, they will have been exposed or have had HPV. But if we have good immunity, and 90+% of the time we get rid of the virus, the problem is persistence of the virus in our system that will lead to neoplasia, dysplasia, or cervical cancer as the time goes on. From the time of infection to having cervical cancer could be 1 year up to 15 to 20 years. So it's very important to follow up with the doctors and screen for it. We also have a vaccine, human papilloma virus vaccine, the newest one on the market by the name of Gardasil, protects us from 9 HPV types, which are very common, and protects almost 85% of developing cervical cancer and or genital warts. So the awareness is to vaccinate the young girls and boys from age of 9 to 26 to everyone in order to decrease the chances of cervical cancer in the future because of sexual encounter when they get older. So the message is, please try to educate yourself to get tested by the physician, and they will tell you on what yearly basis, and if it's positive, they will do a biopsy and go further in investigating, because if diagnosed earlier, we can treat it by surgery and or by prevention of other methods, cutting the area involved if it's too early at the beginning, and save the woman her life. So please help me spread the awareness also in vaccinating our kids, boys and girls alike. Thank you so much.